Hello, I am Dr. Rana Al-Falaki. I am a partner at Alpha Perio Clinic, a specialist periodontal practice in Buckcastle. I may be your periodontist, or you may come to our clinic, or you may be a patient of one of our referring practices. So I just wanted to touch base with you all to firstly let you know that we are here for you and we are supporting you as best as we can, or rather we would want to. For those of you who are our patients, or those of you who are patients of our referring practices who see a hygienist regularly, I can completely understand that at the moment you may well have concerns because we're not able to see you, and unfortunately these are just the government guidelines that are placing all the emphasis, quite rightly, on urgent medical care at the moment. So we've had to close down our practice and there are just urgent care centres available. Now, that's not to say that your oral health is not important. It really is essential. So that message has not actually changed. It's just unfortunately we don't have the facilities to be able to help you with that. So we need to get you to help yourselves, please, as much as possible. So, of course, for those of you who are already my patients, I would have talked to you at length about all the multifactorial aspects that can lead to periodontitis, to gum disease, to bleeding gums. And in this current situation, that may well be exacerbated because, as you all know, stress is a major factor, and understandably, a lot of you may well be feeling and experiencing that right now. You may have fear, you may have worry and concern, you may be isolated, you may be in the vulnerable category and therefore really physically isolated. You may have financial concerns, and that's going to give you added worry and be worrying about lots of people around you. So that's one factor that of course can affect your immune system. And of course we want your immune system strong from my perspective to help keep you being able to fight gum disease, and if you're one of my treated patients, to help keep you stable long term, but also to fight the risk of the virus and keep you generally healthy. So what can you do about that? Well, it's easy for me to click my fingers and say, don't worry, but of course that isn't necessarily going to work. But try to stay positive, try to stay off social media, try to keep as much positivity around you as possible, and try not to let that negativity drain you. So if you're spending time with people who are worrying and moaning and fearful, try to spend equal time with those people who lift you up and inspire you. What else can you do? Well, try to engage in mindfulness, try to engage in meditation. For those of you who haven't tried things like that before, there are all kinds of apps that you can download on the phone. One is called Calm, one is called Insight Timer. There are visualizations as well. So it's not a case of just having to sit here and say, okay, I'm going to meditate now to relax. Because obviously that's easier said than done. You are allowed an hour's exercise a day, so go out for a walk, and you can practice mindfulness when you do that, which means shut down your brain from the worry and actually literally just focus on your steps and watch your feet going forward one by one by one, and by looking at that it shuts your brain off from worrying. So it's just a few little examples, but there's all kinds of things. God, it's my other profession as a coach, so I could sit there and talk to you for hours about that, but that isn't what this video is about. So one thing is to please try to reduce your stress. The other is try to eat as healthily as possible. I think hopefully we're nearing the end of toilet paper saga, and the supermarkets still or now seem to be much better stocked. So try to engage in a healthy diet still. And again, those of you who I've spoken to about in person, you know how important this is. So lots of fresh fruit, fresh vegetables. Yes, good levels of vitamin C needed. Now, vitamin C isn't just in citrus fruit. It's going to be in green vegetables like broccoli. All your coloured foods are really good for you because they're full of antioxidants, which is all potentially going to help you with gum disease. For those of you that are sadly smokers, again, often smoking increases with stress. but please try and be mindful that this could be the perfect opportunity to try to give up, especially those of you that are social smokers, because there's no socializing going on. So this is an opportunity to look back in a few months' time and think to yourself, what would I have wanted to have achieved in that period of lockdown? And if you could turn around and say, I quit smoking, well, I'm going to give you a high five right now. Sorry, it's a bit American, but you know what I mean. And of course, for those of you who are smoking through vaporizing and so on, then obviously I imagine those particular shops are closed right now. But again, if you can find some other distraction rather than increasing the nicotine dose, that would be brilliant. So that's all going to help you. What else can you do? What are your other risk factors? Well, I've mentioned walking, not just from a mindfulness and meditative point of view, but from the fact of getting exercise and getting fresh air. So exercise does boost your immune system. So it's really important if you can be physically active and get exercise, that is going to help you significantly as well. And then, of course, there's the things that coming to a dental surgery or to see either me as a specialist, a dentist or a hygienist, we're all going to tell you the same thing when it comes to brushing your teeth. So please don't feel that there is no point anymore. And remember, if your gums are bleeding, a lot of that you can reduce yourself by really paying attention and focus to the time spent on it. And while a lot of you, I let you get away with, oh, my bathroom was being refurbished, so all my brushes and everything were in the kitchen. Of course, that isn't the case at the moment, because nobody's bathrooms are being refitted unless you're really handy with DIY yourself. So my friends, what do I want you to do? Please try to spend a good 5 minutes a day. Why not? What else have we got to do? So I do appreciate that a lot of people are working from home, and as am I with other things, but there is time and there is opportunity here. So if you can spend a good few minutes a day, set yourself a timer on your phone or an egg timer or something like that to visually watch and just actively engage in looking after yourself in that way. So really spend time brushing all around the teeth, and then don't forget we've got the interdental cleaning that is essential. We know floss doesn't work quite as well. It's great for food removal, but not so much for bacterial removal. So please use those interdental brushes that we would have given you. It's so important. And to remember to use the different size brushes for the different size gaps. Why? Because if you just use a small brush in a big gap, it's going to get food out, but it's not going to clean the bacteria. When you get that brush in, make sure you agitate it a good 5 to 6 times so it really is brushing in between the teeth. Some of you have things like air flossers and water picks as well. That's great. Use those, but use them in addition to the interdental brushes if you have them. If your gums bleed or start to bleed in the odd area when you're using those brushes, then remember, with gum disease, with periodontitis, it is a dynamic process, and therefore sometimes an area suddenly starts to bleed one day where it didn't the day before. That's the bacterial load and the inflammation building up in that site. So spend more time on that area to reduce the bleeding. And you might notice different areas pop up at different times, so have more of a go at those areas. A lot of you would have heard me speaking to you directly about that before, but really try to minimize your risk. Okay, so hopefully that helps you. So remember, you're going to exercise, you're going to eat healthily, you're going to try to reduce your stress as much as possible, and you're going to keep me very much in your mind when you're in the bathroom, brushing your teeth and using your interdental brushes, which, as you know, doesn't have to be done in the bathroom. It can be done, at any separate time of day. If you do end up with swellings or abscesses or pain, please contact your practice, which should have a number that leads you to an urgent care centre to advise you on emergency care. And as soon as we are up and running, we will try to look after you as best as we can. In the meantime, stay safe, stay well, look after yourselves and each other. If you get really stuck on interdental brushes, then please give us a call at the practice 0208 506 0701 or email us on info@alfaperio, al-faperio.co.uk, and we can try and track down where you might be able to get more of those interdental brushes to keep you going and keep your oral health a priority during this time. And we'll see you on the other side. All the best.